students, we're jumping into chapter 35, the endocrine system. This is going to be a general overview of the endocrine system and some of the hormones that work within that endocrine system. So chapter 35 gives you a brief overview of the pineal gland, pituitary gland, which is our master gland, the thyroid and the parathyroid glands, the thymus, the heart, the adrenal glands, the pancreas, the ovaries, and the testes. So we will dig into each of those and talk a little bit more about how they help the body and what their function is. But I do have a really great video I want to share with you on how hormones work. Bear with me while my link loads.
For just $67, you can make as many videos as you want, and you never need to pick up a camera or use any fancy editing software. With Doodly, you drag,
Over the course of our lifetimes, our bodies undergo a series of extraordinary metamorphoses. We grow, experience puberty, and many of us reproduce. Behind the scenes, the endocrine system works constantly to orchestrate these changes. Alongside growth and sexual maturity, this system regulates everything from your sleep to the rhythm of your beating heart, exerting its influence over each and every one of your cells. The endocrine system relies on interactions between three features to do its job: glands, hormones, and trillions of cell receptors. Firstly, there are several hormone-producing glands, 3 in your brain and 7 in the rest of your body. Each is surrounded by a network of blood vessels, from which they extract ingredients to manufacture dozens of hormones. Those hormones are then pumped out in tiny amounts, usually into the bloodstream. From there, each hormone needs to locate a set of target cells in order to bring about a specific change. To find its targets, it's helped along by receptors, which are special proteins inside or on the cell's surface. Those receptors recognize specific hormones as they waft by and bind to them. When this happens, that hormone-receptor combination triggers a range of effects that either increase or decrease specific processes inside the cell to change the way that cell behaves. By exposing millions of cells at a time to hormones in carefully regulated quantities, the endocrine system drives large-scale changes across the body. Take, for instance, the thyroid and the two hormones it produces, triiodothyronine and thyroxine. These hormones travel to most of the body's cells, where they influence how quickly those cells use energy and how rapidly they work. In turn, that regulates everything from breathing rate to heartbeat, body temperature, and digestion. Hormones also have some of their most visible and familiar effects during puberty. In men, puberty begins when the testes start secreting testosterone. That triggers the gradual development of the sexual organs, makes facial hair sprout, and causes the voice to deepen and height to increase. In women, estrogen secreted from the ovaries signals the start of adulthood. It helps the body develop, makes the hips widen, and thickens the womb's lining, preparing the body for menstruation or pregnancy. An enduring misconception around the endocrine system is that there are exclusively male and female hormones. In fact, men and women have estrogen and testosterone, just in different amounts. Both hormones play a role in pregnancy as well, alongside more than 10 other hormones that ensure the growth of the fetus, enable birth, and help the mother feed her child. Such periods of hormonal change are also associated with fluctuations in mood. That's because hormones can influence the production of certain chemicals in the brain, like serotonin. When chemical levels shift, they may cause changes in mood as well. But that's not to say that hormones have unlimited power over us. They're frequently viewed as the main drivers of our behavior, making us slaves to their effects, especially during puberty. But research shows that our behavior is collectively shaped by a variety of influences, including the brain and its neurotransmitters, our hormones, and various social factors. The primary function of the endocrine system is to regulate our bodily processes, not control us. Sometimes disease, stress, and even diet can disrupt that regulatory function, however, altering the quantity of hormones that glands secrete or changing the way that cells respond. Diabetes is one of the most common hormonal disorders, occurring when the pancreas secretes too little insulin, a hormone that manages blood sugar levels, and hypo and hyperthyroidism occur when the thyroid gland makes too little or too much thyroid hormone. When there's too little thyroid hormone, that results in a slowed heart rate, fatigue, and depression. And when there's too much thyroid hormone, weight loss, sleeplessness, and irritability. But most of the time, the endocrine system manages to keep our bodies in a state of balance. And through its constant regulation, it drives the changes that ultimately help us become who we are. If you want to learn more about the ins and outs of the human body, start with this playlist or subscribe to our channel.
Okay, let's jump back in. I do have a pre-test, so I'm hoping that you read the chapters for the endocrine system prior to this PowerPoint. So some pre-test questions for you. The pituitary gland is located in the what? A, neck, B, head, C, abdomen, or D, the reproductive organs. I'll give you a second to answer. Correct answer is the head. The pituitary gland is located inside of the brain, deeply seated in the middle portion of the head. Okay. Second question. Intake of protein and what are needed to synthesize both thyroid hormones, T3 and T4? What do you need? You need protein and A, iodine, B, glucose, C, fats, or D, carbohydrates? Correct answer is A, iodine. Iodine is needed to prevent thyroid disorders. What hormone is and or are secreted by the adrenal cortex? Epinephrine, norepinephrine, corticosteroids, or insulin? Adrenal cortex. So there's the adrenal medulla and the adrenal cortex. They're both parts of the adrenal glands. Which is the adrenal cortex? Adrenocorticotropic hormone causes the production of corticosteroids. The pancreas is responsible for producing insulin and glucagon, insulin and glucose, estrogen and prolactin, or epinephrine and norepinephrine. It's going to be insulin and glucagon. Glucagon works inside of the liver, but it's secreted by the pancreas. Number 5, the principal action of the thyroid gland is A, increasing sodium reabsorption and potassium secretion, B, stimulating growth by promoting protein synthesis, C, increasing the secretion of glucocorticoids, D, increasing the metabolic rate. The correct answer here is to increase the metabolic rate. Remember, your thyroid is going to have a huge role in your metabolism. 6 is glycosylated hemoglobin, or hemoglobin A1C, is a measurement of blood glucose over a period of what? A period of several days, a period of several weeks, a period of 6 months or longer, or a period of 1 year. Hemoglobin A1C. It's going to be several weeks. It's going to be a great indicator of how well controlled your diabetic was during that several week period. Which value is considered in the good range for a glycosylated hemoglobin or a hemoglobin A1C in patients that have diabetes? 4.9 to 6.7, 7.6 to 8.5, 9.4 to 10, or 12.1 to 13? The correct answer is going to be 7.6 to 8.5%. Remember, this is an abnormal hemoglobin A1C, but your patient is a diabetic. And this range says that we've got good control of our diabetes. Number 8, without mineral corticoids, a person would die within how many days as a result of lack of control of their fluid balance, blood volume, and all chemical processes and glandular functions in the body? Remember, your mineralocorticoids are going to be things like aldosterone that helps you conserve water, conserve sodium, excrete potassium, and therefore control your fluid balance, blood volume, and chemical processes. How long can you go without them? The correct answer here is 3 to 7 days. So you can last 3 to 7 days without your mineral corticoids. Number 9, an overgrowth of the thyroid gland or a goiter can occur from insufficient iodine intake, so not taking in enough iodine. Remember, you need iodine and protein to synthesize thyroid hormones, and you have thyroid conditions when you don't get enough iodine. So the major source of iodine for most people in the US is what? A, seafood, B, poultry, C, pork, or D, iodized salt? Correct answer here is iodized salt. Iodized salt is the huge source of iodine for United States citizens. Seafood is also a great source of iodine. It's not as great as the iodized salt. However, we added the iodine to our salt to get it into our folks. And number 10, the normal value for a fasting blood glucose level is what? 50 to 80 milligrams per deciliter, 80 to 105 milligrams per deciliter, 70 to 115 milligrams per deciliter, or 100 to 130 milligrams per deciliter. And this is going to fluctuate based on where you're working, what your hospital policy or protocol is, their reference range. However, the book does have a number, and that is what this pretest question is asking you about. And that is 70 to 115 milligrams per deciliter. Okay, so as far as theory objectives, or the objectives that we have for class today or for this lecture, is to identify the location of each endocrine gland, to diagram the principal actions in the target tissues for hormones that come from the hypothalamus, the pituitary, the parathyroid glands, the adrenal glands, and the pancreas glands, to summarize the effects of the thyroid hormones, and to compare care for common diagnostic tests for the endocrine system. Clinical practice objectives. So this is how we want you to integrate theory or didactic or classroom learning into clinical care. So after learning this information, we want you to be able to consider specific age-related changes of the endocrine system in your older adults, so you know what to look for. To reinforce teaching about diagnostic tests that might be performed for symptoms of endocrine disorders, to perform a focused examination or a data collection on a patient that possibly has an endocrine disorder, and to distinguish appropriate nursing interventions for problems that are common to patients with endocrine disorders. We already talked about some of the organs and structures of the endocrine system. I will tell you that one that we don't talk much about is the thymus gland. We don't test heavily on the thymus gland. The thymus gland, it loses some of its function around the time of puberty, but I want you to know that the thymus gland is really involved in our immune system and our immune response as well. So it's not just part of the endocrine system, it's also part of the lymphatic system. Functions of the endocrine system. So as a whole, these organs and their hormones work together to do what? Well, they alter chemical reactions and they control the rates at which chemical activities take place within the cells. We saw that in the video. They also change the permeability of cell membranes, which allows substances to be transported across the cell membranes. Think insulin, right? Insulin can't get into the cell, glucose can't get into the cell unless insulin allows it. Insulin is the key by which glucose can be used by the cells for energy. So without insulin, we can't use glucose, and it just continues to accumulate and build up in our bloodstream instead of going into the cells to provide them with the energy they need to do work. Also, the endocrine system works to activate particular mechanisms within the cell, like systems that control growth and reproduction. Effects of the pituitary hormone. So let's talk a little bit about the pituitary hormones. So there's an anterior portion of the pituitary gland and a posterior portion. The anterior pituitary produces a lot of hormones and the bulk of our hormones. The posterior pituitary does not produce hormones, but it does release hormones that are very important for the body to do work. There are three primary hormones we're going to discuss coming from the posterior pituitary. So hormones secreted into the bloodstream from releasing hormones that come from the hypothalamus can be secreted from the pituitary. Let's make that really simple because that sounded really confusing. The hypothalamus releases hormones or secretes hormones that are releasing hormones. These are hormones that allow the pituitary gland to secrete its hormones. So then the pituitary secretes its hormones, which may or may not directly impact tissues. And then those target organs, maybe like TSH, for example, targets the thyroid gland. Then that organ, the thyroid or the gland of the thyroid, begins to produce its own hormones. So T3, T4, and our thyrocalcitonin. Dysfunction of the pituitary gland will affect one or more hormones because the pituitary gland is responsible for regulating those hormones in their, those glands in their production of hormones. So let's look at this in a broken down visual. So my favorite picture is this one. I use this picture to memorize each of the pituitary gland hormones and how they affect the various target tissues. So let's start with growth hormone. The anterior pituitary is going to be this darker pink left section, right? And the anterior pituitary secretes growth hormone. Growth hormone targets tissues, cells, to promote tissue growth. Too much growth hormone, and you have a condition called acromegaly, which is characterized by too much tissue growth. Too little tissue growth, and you have a condition known as pituitary dwarfism, which is characterized by not producing enough tissue growth. Then you have the hormone TSH. This stands for thyroid stimulating hormone. And that's exactly what this hormone does. It stimulates the thyroid to produce hormones. So the TSH is secreted by the anterior pituitary, and it affects the thyroid gland and helps it make thyroid hormones like T3, T4, and thyrocalcitonin, also known as calcitonin. The third hormone that comes from the anterior pituitary is ACTH, adrenocorticotropic hormone, and it works on the adrenal glands to allow them to produce their cortical hormones. Think your corticosteroid, cortisol, and your mineralocorticoid, aldosterone. Okay? So without ACTH, the adrenal gland would not do its job of producing its adrenal hormones. The fourth hormone secreted by the anterior pituitary is FSH, follicle stimulating hormone, and it works on both the testes and the ovary in order to produce their ova, right, their sperm that are going to be ready for fertilization and the process of fertilization. Same thing with luteinizing hormone, or LH. These hormones also work together to produce testosterone, estrogen, progesterone, all of those sex hormones. And that is all of the anterior pituitary hormones. We also have posterior pituitary hormones. The three primary posterior pituitary hormones are prolactin, oxytocin, and ADH. Prolactin helps to develop breast glandular tissue. Oxytocin stimulates uterine contraction and lactation, and it also helps us with well-being and social relationships that are appropriate, um, keeping us content and happy, our mood, right? So if we have too little oxytocin, we may have issues with the ability to produce babies through labor, or the ability to lactate, or feelings of depression, or issues with our social relations, right? It's that feel-good hormone. And then we have ADH. ADH is antidiuretic hormone. It is so important. When we see trauma to the pituitary gland, the first thing we're concerned about is ADH being affected. ADH helps with kidney water reabsorption, so fluid balance, right? Too much ADH, antidiuretic hormone, think no pee hormone, right? Too much of the no pee hormone and you're not peeing. This is a condition called syndrome of inappropriate antidiuretic hormone, lovingly known as SIADH. Because they have too much ADH or no pee hormone, they're extremely swollen with low urine output, also known as oliguria, and they have significant electrolyte imbalances. Too little ADH, and you have a condition known as diabetes insipidus. No, diabetes insipidus has nothing to do with diabetes mellitus. However, people in diabetes insipidus are drinking a lot, like your diabetes mellitus patients, but they are completely unrelated. Diabetes insipidus is the inability to conserve water through kidney water reabsorption because you don't have enough of the no pee hormone. So you're producing copious amounts of clear, dilute urine, and you become internally dehydrated despite adequate PO intake. So we'll learn more about all of the various conditions that affect or that come from issues in the pituitary gland and its hormones, the target tissues and their hormones, but that will come a wee bit later. Effects of aging on the endocrine system. So as the body ages, the endocrine system does respond in various ways. The pituitary gland gets smaller. The thyroid may become lumpy or nodular. Hormones may either decrease or increase depending on what they are, whether they're sex hormones or thyroid hormones, right? Specifically, thyroid hormone levels decrease. We also see blood glucose levels rise, and they rise constantly or consistently over the course of the lifetime. Let's talk specifically about the thyroid hormones. I'm going to show you a video on thyroid hormones.
I was never able to find a bra that fits my small chest. For as long as I can remember, being small was something.
Nestled in the tissues of your neck is a small, unassuming organ that wields enormous power over your body. It's called the thyroid. Like the operations manager in a company, its role is to make sure that the cells in your body are working properly. It does that by using hormones to deliver messages to every single one of them. This high-ranking organ is made up of lobules that each contain smaller cells called follicles, which store the hormones the thyroid sends out into your blood. Two of the most important hormones it produces are thyroxine and triiodothyronine, or T3 and T4. As messengers, the hormone's job is to instruct every cell in the body when to consume oxygen and nutrients. That maintains the body's metabolism, the series of reactions our cells perform to provide us with energy. This hormonal notification from the thyroid gets the heart pumping more efficiently and makes our cells break down nutrients faster. When you need more energy, the thyroid helps by sending out hormones to increase metabolism. Ultimately, the thyroid allows our cells to use energy, grow, and reproduce. The thyroid is controlled by the pituitary gland, a hormonal gland deep in the brain that oversees the thyroid's tasks, making sure it knows when to send out its messengers. The pituitary's role is to sense if hormone levels in the blood are too low or too high, in which case it sends out instructions in the form of the thyroid-stimulating hormone. Even in this tightly controlled system, however, management sometimes slips up. Certain diseases, growths in the thyroid, or chemical imbalances in the body can confuse the organ and make it deaf to the pituitary's guiding commands. The first problem this causes is hyperthyroidism, which happens when the organ sends out too many hormones. That means the cells are overloaded with instructions to consume nutrients and oxygen. They become overactive as a result, meaning a person with hyperthyroidism experiences a higher metabolism, signaled by a faster heartbeat, constant hunger, and rapid weight loss. They also feel hot, sweaty, anxious, and find it difficult to sleep. The opposite problem is hypothyroidism, which happens when the thyroid sends out too few hormones, meaning the body's cells don't have as many messengers to guide them. In response, cells grow listless and metabolism slows. People with hypothyroidism see symptoms in weight gain, sluggishness, sensitivity to cold, swollen joints, and feeling low. Luckily, there are medical treatments that can help trigger the thyroid's activities again and bring the body back to a steady metabolic rate. For such a little organ, the thyroid wields an awful lot of power. But a healthy thyroid manages our cells so effectively that it can keep us running smoothly without us even noticing it's there.
I love that video. I think it does a really good job of explaining how the thyroid regulates metabolism. So we learned that the thyroid gland produces three primary hormones: T3, triiodothyronine; T4, thyroxine; and thyrocalcitonin, which is called calcitonin. Okay. The thyroid hormones work together to produce heat, synthesize protein and lipids, form coenzymes from our vitamins that we get in our diet or supplements, regulate our carbohydrate metabolism, and they affect the tissue response to epinephrine and norepinephrine. Parathormone. So parathyroid hormone is also known as parathormone. It's secreted by the 4 parathyroid glands that sit behind the thyroid. So the thyroid's that bow tie or butterfly shaped gland that releases T3, T4, and thyrocalcitonin, also known as calcitonin. And then behind that butterfly or bow tie shaped gland, you have your 4 to 6 pea-sized parathyroid glands that secrete parathormone. Parathormone acts on those renal tubules to increase the excretion of phosphorus in the urine. It acts on the renal tubules to stimulate the reabsorption of calcium. It stimulates the production of vitamin D, the active form, which enhances calcium absorption in the small intestine. And it acts on the bone, which causes the release of calcium from the bone into the bloodstream and raises the serum calcium. The job of parathormone is to increase serum calcium, whereas the job of calcitonin, which we didn't talk a whole lot about on the last slide, and remember it's a thyroid hormone, not a parathyroid hormone, is to decrease serum calcium and move the calcium into the bones. So they balance each other. These guys work together to balance. And parathormone and calcitonin together regulate that plasma level of calcium. So these are 2 opposite hormones working together to balance out calcium. Calcitonin or thyrocalcitonin takes calcium from the blood and puts it in the bones to make those strong, healthy bones. Parathormone or parathyroid hormone takes calcium from the bones and puts it in the blood. Okay, parathormone raises blood calcium, and calcitonin lowers blood calcium. So if someone were to have a calcitonin deficiency, so remember calcitonin lowers blood calcium by taking calcium in the blood and putting it in the bones. So if they don't have enough of that, then they're not going to be producing those strong, healthy bones. They may have brittle bones, increased risk of fractures, osteopenia or osteoporosis. If someone were to have a parathormone deficiency, so this is not enough calcium in the blood because we are putting it all in the bone, right? There's no pulling of the calcium from the bone into the blood. They would have hypocalcemia due to a low serum or low blood calcium. Mild symptoms of this could include tingling, muscle spasm, cramping. Severe symptoms of hypocalcemia and therefore parathormone deficiency can include tetany or convulsions. Okay, moving on. So we've talked about the thyroid gland, we've talked about the parathyroid glands. Let's talk about the adrenal gland hormones. There are two portions of the adrenal gland. The medulla, which is in the middle, think medulla, right? And it secretes epinephrine and norepinephrine, or catecholamines, when it's stimulated by the sympathetic nervous system. However, we're not going to dig a ton into this. I will have an image on the next slide to talk about, but for the purposes of this class and specifically this module, I want you to focus on the adrenal corticosteroids, or what the adrenal cortex hormones are. We'll revisit the catecholamines during neuro. So the adrenal cortex secretes your adrenal corticosteroids, so your glucocorticoids and your mineralocorticoids, okay? The adrenal gland also secretes small amounts of androgenic hormones, which are like sex hormones. They have similar effects to those of the male and female sex hormones. Let's talk about epi. So epinephrine is released from the medulla of the adrenal gland, or the middle of the adrenal gland. And here's kind of the system by which its stimulation occurs. You're undergoing stress, or you have increased physical activity, or you have a low blood glucose. For the purposes of explaining, let's assume that the person has all three. This person is running from an axe murderer. They have a high level of stress, high level of physical activity, and they're not stopping to eat, so they have a low blood glucose. The hypothalamus is going to pick up on this. The hypothalamus, which is in the brain, is going to send that nerve impulse from the hypothalamus to the spinal cord. It's going to travel down the spinal cord, and then via the sympathetic nerves is going to tell the medulla of the adrenal gland, hey, we're being chased by an axe murderer. We need to do something. The medulla is going to respond by releasing epinephrine. Epinephrine is going to increase blood glucose so that we have energy or sugar to do the work, right? It's going to increase your breathing rate, dilate the bronchioles to allow the lungs to bring in more oxygen, to bring oxygen to the tissues, and increase overall oxygen saturation as you're running from the axe murderer. It's also going to decrease the function of digestive organs. It doesn't make any sense to stop and go potty while you're running from the axe murderer, and therefore peristalsis of the bowels is going to slow, and the stomach's secretion of digestive enzymes is going to slow. We don't need a gurgling tummy or the urge to defecate while running from the axe murderer. It is also going to divert blood to the skeletal muscles to allow them to do good work. It's going to increase your cardiac muscle contraction and your heart rate so that the heart can pump more intensely and quicker to get lots of good blood, oxygen, and nutrients to the cells so that they can do work to get away from the axe murderer. And it's going to increase the metabolic rate, or the uptake of nutrients by the cells. Okay, now put that on a bookshelf. We'll revisit that later in the term, okay? I want you to really clue in, key in on aldosterone and cortisol, okay? So these are your corticosteroids, your glucocorticoid, and your mineralocorticoid, okay? So same thing happens. Stress or low blood glucose stimulates the hypothalamus. Okay, think nursing school. Okay, while we might not have a low blood glucose in nursing school because we like to eat a lot of food while we study, we do have increased amounts of stress. Our hypothalamus is going to pick up on that stress, and it's going to secrete a ACTH releasing hormone. The ACTH releasing hormone targets the pituitary, and it tells that pituitary to secrete ACTH, adrenocorticotropic hormone. Now, adrenocorticotropic hormone has a major effect and a minor effect. The major effect of adrenocorticotropic hormone is that the adrenal cortex secretes cortisol, your stress hormone. Cortisol does three things, and these aren't the three things underneath target tissue, so I want you to really listen and take some good notes. Cortisol increases blood glucose, decreases the immune system response, and decreases inflammation. Think hydrocortisone cream for the person with inflamed eczema, or prednisone or methylprednisolone for the patient that has an autoimmune condition like rheumatoid arthritis. Okay. In addition to ACTH causing the adrenal cortex to secrete cortisol, the ACTH also affects the adrenal cortex by secreting aldosterone. Aldosterone is going to work inside of the kidney tubules or the renal tubules to excrete potassium, reabsorb sodium, and conserve water, and therefore reduce urine and increase blood volume. Having a high level of potassium in the blood, low level of sodium in the blood, or having a low blood pressure or low blood volume can also stimulate the secretion of aldosterone to achieve the same effect. Okay, changing gears. We talked about thyroid hormones, we talked about parathyroid hormones, we talked about the adrenal hormones. Let's talk about the pancreatic hormones, or those hormones that come from the pancreas. The pancreas is both an endocrine and an exocrine gland, which means that it secretes both directly into the bloodstream and through a duct to hit that target tissue. It produces two primary hormones, insulin and glucagon. The beta cells produce insulin. Okay, so the beta cells of the pancreas produce insulin. Those beta cells live inside the islets of Langerhans. Insulin is needed by the body. Why? Because it helps the body use blood sugar or glucose. If we don't have insulin, insulin is the key that opens the cell to allow the glucose to come in, then the glucose just hangs out in the blood and it begins to accumulate. Therefore, we have a rising blood glucose, but the cells aren't able to take up the sugar and do work with them. So insulin is necessary. There are also alpha cells within the pancreas, and alpha cells release the other primary hormone of the pancreas, glucagon. Glucagon actually works inside the liver. It is secreted by the pancreas, but works in the liver. And glucagon works in the liver to change glycogen, which is stored glucose or stored sugar, into active glucose again to raise serum blood sugar. Okay, and here's a really good video of, or excuse me, also a video, but a image of what happens. So let's say you have a normal blood glucose, whatever the reference range of the facility is or the policy, and you eat something. Whether it be low carb or high carb, if it has carbohydrates, it's going to raise blood glucose. So please know that even low carbohydrate meals will increase blood glucose. And so we have increased carbs from eating, and our blood glucose goes up, and that stimulates the beta cells in those islets of Langerhans to secrete insulin. Insulin is going to be the key that opens the cell and allows it to uptake the glucose. Use it for work. It also is going to work to change glucose into glycogen into the liver, right? It's going to help store away excess glucose as glycogen or stored glucose in the liver. It's also going to work to stimulate the storage of sugar as adipose tissue or fat. So it takes that increased sugar and it puts it into fat cells so that we have access to it at some point in time in the future should we need it. And therefore, because it's done something with the sugar, it's either put it in the cells to do work, put it into the liver as glycogen as storage, put it into the cells as adipose tissue or fat storage, the glucose level is going to decrease and we're going to resume a normal blood glucose. Let's say the opposite happens. You skip a meal, you administer insulin. There'll be a decreased blood glucose in response. Those glucose levels will fall, and somatostatin will work to inhibit the release of insulin. We don't want any insulin because our blood glucose is low, right? Because insulin will just continue to lower that blood glucose. So decreased glucose would stimulate the alpha cells to secrete glucagon as well. So not only do we not have the production of insulin, we also have the secretion of glucagon. And glucagon is that really awesome hormone that stimulates both the non-carbohydrate conversion to glucose and the conversion of glycogen into active glucose to send into circulation, right? To thereby increase your blood sugar, your blood glucose, and bring you back to that normal blood glucose. I have a really great video to reiterate this. I'm going to play it now, so just bear with me as the link loads.
Insulin and glucagon. In a previous lesson, we learned about hormones and their roles in regulating and maintaining important processes in our body. In this lesson, you will learn about how your blood glucose level is regulated or controlled by two important hormones, insulin and glucagon, via a negative feedback system. When you consume a meal that is high in carbohydrates, such as rice, pasta and bread, this will cause your blood glucose level to increase. Carbohydrates are essentially long chains of repeating glucose monomer units, much like beads on a necklace. During digestion, this is broken apart into glucose, which is absorbed into our bloodstream. This increased blood glucose level causes a gland known as the pancreas to secrete a hormone called insulin. Remember that a gland secretes hormones which act on specific target organs. In this case, the target organ is your liver, which is stimulated to convert glucose to glycogen. Glycogen is basically long multi-branch chains of glucose monomers stored in liver and muscle cells. Insulin also causes your body cells to uptake or take in glucose. So this decreases your blood glucose level back to its optimal state. When this system is faulty, this leads to a medical condition known as diabetes. If you want to learn more about diabetes, this will be addressed in another video. The same response also occurs when you consume foods and drinks high in sugar such as sweets, cakes and fizzy drinks. When your blood glucose level drops, such as when you are hungry, the pancreas secretes a hormone called glucagon. Like insulin, the target organ for glucagon is also the liver, though it stimulates the opposite process, the breakdown of glycagon into glucose. This increases your blood glucose level back to its optimal state. So to review, insulin and glucagon are two hormones released by the pancreas, which act on the liver to regulate our blood glucose level.
Okay guys, so let's get back to the PowerPoint. Okay, we're going to go back to just a vague upper level overview, right? Endocrine system disorders. So we know how our endocrine system works in our body. What causes issues inside of the endocrine system? Well, it could be a primary dysfunction or a secondary dysfunction. Primary dysfunctions are issues within the gland itself. So maybe it's over-secreting or hyper-secreting, or under-secreting, also known as hypo-secreting. Maybe there's a tumor or inflammation inside of the gland. Maybe it's infected, or it's had some kind of mechanical damage, or an autoimmune response is causing the gland to over or underproduce. Secondary dysfunction comes from outside of the gland. Maybe the patient is on a medication that's causing a endocrine disorder secondary to the medication, or trauma. Maybe the body has undergone a tremendous amount of trauma and therefore there's some kind of dysfunction related to the trauma. Or we're administering hormones, either a hormone supplement or a hormone blocker. Secondary dysfunction can either be temporary or permanent. So once we stop taking the medication, or once the effects of the trauma subside, or we stop the hormone therapy or the hormone blockers, we may see a improvement, a return to normal function. Or secondary dysfunction can be permanent. So just keep that in mind. Nursing management of endocrine disorders. What is our goal as the nurse? Well, we want to get a really thorough, focused examination or data collection of the patient, right? And then we need to make sure that care plan is dynamite. So the nursing diagnosis is assigned by your RN, but you just want to make sure that you think that it's appropriate for the patient, right, based on your knowledge and understanding. And then you're going to contribute to the nursing care plan by revising or assisting in the establishment of SMART goals, and you're going to implement the care plan, right? That's a big part of the LPN scope of practice, is that implementation of the care plan. And then following the implementation, you're going to work collaboratively with the RN to evaluate the patient response to your SMART goals and nursing interventions. And then a super important part of follow-up as we take care of these patients is getting them involved in community resources, community support, and community care. So make sure to keep that on your radar when creating care plans for your patients. General nursing goals with patients that have endocrine disorders: want to prevent injury, maintain fluid and electrolyte balance, maintain hormone balance, reduce stress, promote the use of effective coping mechanisms. We want to increase knowledge of self-care and make sure that our patients really know how to take care of themselves, especially diabetics, right? That's a big one for them. To increase their tolerance of physical activity, to promote normal bowel function, to improve the mental and emotional status of the patient, and to integrate or improve body image. Cushing syndrome is a big one for that. Okay, so that is the gist of the Chapter 35 PowerPoint. We do have 2 other PowerPoints for this module on the endocrine system. I would encourage you to reread your textbook, go over your notes, and of course print this PowerPoint and work to bring them all together into a really good synopsis for studying. Okay, thank you so much.